BC's Minister of Health. Joining me today, I'll look over, is the President and CEO of BC Hydro, Chris O'Reilly. I'm honored to have Chris here. I want to start by acknowledging the territory of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. It's an honor and privilege to be here on their lands. Climate change is an undeniable reality that affects every aspect of our lives, including our health. The social determinants of health are sometimes expressed in a complex way. People have different needs, and climate change affects people's lives in different ways, but in a way that can affect their health, their mental health, and their lives as a whole. Unprecedented changes are taking place, leading to rising temperatures, extreme weather events, and a multitude of environmental impacts. Globally, and here in British Columbia, we are witnessing a range of health impacts that are directly linked to changing climate patterns. Increased heat-related illnesses, rising temperatures, and more frequent heat waves are endangering vulnerable populations, such as the elderly with pre-existing medical conditions. Heat-related illnesses, including heat stroke and cardiovascular problems, are becoming more common and can have severe consequences. Air quality and respiratory issues. Climate change exacerbates pollution, particularly in urban areas. Poor air quality poses a significant risk to respiratory health, leading to an increase in respiratory diseases, including asthma and chronic obstructive pulmonary disease, often known as COPD. Infectious diseases and vector-borne illnesses. Climate change influences geographic distribution of infectious diseases, creating favorable conditions for the proliferation of disease-carrying insects such as mosquitoes and ticks. And of course, mental health challenges. Climate change induced natural disasters such as wildfires and floods not only have significant effects on our physical health, but profound psychological effects on individuals and communities. Displacement of people, loss of property, and the emotional toll of witnessing environmental destruction contribute to increased rates of anxiety, depression, and post-traumatic stress disorder. Vulnerable people are among the most likely to experience the effects of extreme heat and suffer from these climate change-related impacts to the social determinants of health. That's why every year we are continuing and working to improve our public health care system so it can be more resilient and prepared to protect the most vulnerable among us from the evolving effects of climate change and extreme heat. Which brings me to today. Today I'm pleased to announce that the government is taking new action to invest $10 million in BC Hydro to provide free air conditioning units to vulnerable people throughout the province. Through this program, people will be able to apply through BC Hydro to be considered for free air conditioning units under the program. In addition, health authorities will work with their home health teams to identify community-based vulnerable clients and assist them in working with BC Hydro to gain access to free air conditioning units through this program. BC Hydro has already launched a pilot program, as you know, to begin providing access to air conditioning units, and this additional $10 million is expected to offer approximately 8,000 more units to vulnerable people across the province. As we know, the majority of those who passed away during the heat dome were 70 years of age or older, and 90%, 90, were over the age of 60. We know that most people who died as a result of heat-related causes in June 2021 lived with chronic disease that potentially impacted their mobility and cognition. More than half of those who died lived alone, many of them living in areas of higher material and social concerns. That's why this program will start by supporting lower income and vulnerable individuals who are at higher risk of heat-related impacts. With the initial funding of $10 million, approximately, as I noted, 8,000 air conditioning units can be installed over the next 3 years. It is anticipated that at least 50% of air conditioning units will be installed in apartments or multi-unit dwellings, with the balance in single-family dwellings, and BC Hydro will work with a contractor to assess electrical requirements, air conditioner replacement, installation, and provide training on how to use the air conditioner. In addition to the approximately 8,000 air conditioners out of the $10 million grant that will be provided over the next 3 years, you may recall we recently provided a grant to the United Way, the Ministry of Health, of $1 million to distribute emergency preparedness grants to seniors organizations for emergency kits, climate emergency plans focused on notification, check-ins, and transportation, and importantly, cooling devices. And furthermore, BC Hydro is providing some grants of its own and partnering with BC Housing, Vancouver Coastal Health, and other organizations to provide a further $1.7 million to install an additional 1,500 air conditioning units for social housing units, $150,000 to Coastal Health for the purchase, delivery, and installation of larger portable air conditioning units to community organizations such as senior centers and neighborhood houses so they can create cooling sites during heat events. Further, $150,000 to Praxis Spinal Cord Institute and Technology for Living to provide access to portable cooling devices for people with spinal cord injuries and other disabilities. This brings the estimated total air conditioner procurement closer to 10,000 units and the total investment well over $12 million. And we are very pleased and appreciate very much the initiative of BC Hydro in this area. In total, we're taking a broad approach and investing in multiple initiatives to address air conditioner installation, maintenance, electrical capacity of dwellings, landlord or strata regulations, and medical assessment need to support cooling in people's homes, whether private residences, social housing, or long-term care facilities. This means more vulnerable people will have access to cooling devices when we experience high temperatures and can keep themselves and their loved ones safer from extreme heat. As we all know, in the summer of 2021, from June 25th to July 1st, many areas of BC experienced an unprecedented heat dome. Tragically, the BC Coroner's Service concluded that 619 people passed away from heat-related illnesses. In the same week, BC hospitals experienced a significant spike in the number of emergency department visits and admissions related to people experiencing heat-sensitive conditions. The healthcare system, of course, at that time, was already supporting people displaced from a terrible wildfire season in 2021 and was continuing to respond to the toxic drug crisis and the ongoing COVID-19 pandemic. It was already operating at capacity levels, and emergency response teams were, especially in that weekend, overwhelmed with the volume of demand from people suffering from extreme heat-related impacts when the heat dome struck. During this extraordinary weather event, BC health authorities recorded 1,090 more heat-sensitive emergency department visits and 728 more heat-sensitive admissions than would typically be expected during this period. Most of the population of BC, typically in many parts of BC, are not used to hot weather, particularly in June, especially extremely hot weather. It was true everywhere. In my apartment in East Vancouver, one evening it was 36 degrees indoors at 2 in the morning. Historical weather patterns in BC mean that most of our infrastructure was not built with extreme heat temperatures in mind. The heat dome of 2021 was seen then as a 1 in 1,000 event, and it had been. But now, of course, it occurred 2 years ago, and we see with the impact of climate change that such events may well happen, not 1 in 1,000, but 1 in 10, 1 in 5, and so on. With the goal of learning from the 2021 heat dome experience to improve public safety and prevent further deaths, the Chief Coroner of BC, as you know, convened a panel to review the circumstances around the heat-related deaths. The panel's report, Extreme Heat and Human Mortality, a review of heat-related deaths in BC in the summer of 2021, was released 2 months later. The report showed that the people who died, as I noted, were primarily elderly persons. 90%, 90, were over the age of 60, with one or more chronic diseases that could have impacted their mobility or cognition. For example, 37% were dealing with diabetes, and even more were dealing with other conditions. 56% of those who passed away lived alone. 74% lived in that case, within the Fraser and Vancouver Coastal Health Authorities. And many of those who passed away were living in areas that were overall lower income, had less access to trees, and so on. Fortunately, there were no deaths amongst infants or children or persons younger than the age of 30. In that case, we understood and understand from what was a very significant, even cataclysmic event for some, and for some communities, the impact of heat, particularly on vulnerable populations. The coroner's report recommended 14 priority actions to help British Columbians better prepare for future extreme heat events. Among the overarching recommendations was the implementation of a coordinated provincial heat alert and response system, also known as HARS. In June 2022, as you know, BC HARS was successfully rolled out across BC, including all levels of health system, emergency management, Indigenous and local communities and organizations that work particularly with vulnerable populations. To further support people during extreme emergencies, the government is investing $369 million in the Community Emergency Preparedness Fund and targeted grants for First Nations and municipal governments. These grants support public notification and evacuation planning, emergency support services, and extreme temperature risk mapping, assessment, and planning to help communities mitigate and prepare for disasters and climate-related emergencies. In addition, more than $52 million is invested to support long-term care facilities to install or upgrade existing HVAC systems, which include air conditioning. This means we installed new air conditioning or HVAC at 47 facilities for the first time and upgraded 149 facilities throughout the province. As you also know, in the last few weeks, we've announced in the case of 5 projects, about $1 billion investment in new publicly owned and operated long-term care homes. As people will know, there had been very little investment in the years prior to my being Minister of Health. $17 million over 10 years in long-term care capital prior to my becoming Minister of Health. We are investing in our current fiscal plan more than $2 billion in such facilities. That's 125 times more. We're also distributing an emergency inventory of cooling and clean air items to nonprofit operators through BC Housing, as noted, and we're connecting home and community care providers to people who are most at risk within the home health programs across BC. Indeed, we saw a measurable difference between those who were receiving home health during the period of the heat dome. We also responded, as you'll know, within BC Emergency Health Services to expand the workforce while ensuring they are supported so they can provide the best care possible to people. Budget 2022, for example, provided $148 million over 3 years to increase the number of paramedics and dispatchers, and Budget 2023 provides $130 million over 3 years to increase the on-call rate for paramedics and expand ambulance coverage throughout BC. We have added 125 new full-time paramedic positions, 42 new full-time dispatch positions, 22 new ambulances to provide care in rural and remote communities. We've also increased clinical support in BC EHS dispatch centers, developed priority triage, so calls from ECOM to BC EHS are answered 4 times faster than calls through the standard 911 BC EHS queue. We're working with health authorities to reduce ambulance turnaround times to help paramedics get back on the road and respond to calls faster. And we're transitioning the BC EHS workforce, as you know, which was 30% full-time or part-time staff when I became Minister of Health, to well over 60% now, and more and more and more as we go forward. In addition, we've invested significantly in the mental health of our ambulance system. And our Chief Ambulance Officer, who was appointed some weeks after the heat dome, has taken extraordinary action to support all workers and to ensure a safe and healthy workplace at BC EHS. Today's announcement with BC Hydro builds on actions taken over the last 2 years to support people during extreme heat events and increase access to healthcare services around the province. Extreme weather has become part of our reality, and therefore it remains important to continue taking action to ensure people are able to stay safe during these times. Our top priority has and continues to be people. With every action, measure, step we take, at its heart has to be people, and today is no different. I want to remind everyone to learn the signs of heat illness, review the Extreme Heat Preparedness Guide, and have a plan in place to stay safe this summer and whenever we have periods of high heat, to check on the ones you love, particularly those living alone. It's now my honor, and I want to express my appreciation to BC Hydro for its response to this initiative and its leadership in this initiative. It's my honor to introduce the President and CEO of BC Hydro, Chris O'Reilly, to say a few words.
Well, thank you very much, Minister, and thank you for being here today. I also want to acknowledge that we're gathered on the traditional and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh First Nations, and recognize that we're privileged to be on the path of reconciliation with all 3 communities. Because of global warming, we at BC Hydro are seeing an increase in demand for electricity in the summer months as more British Columbians turn to air conditioning for longer periods of time to cool down during heat events. In fact, BC Hydro broke its peak hourly demand record for May, the hour where customers used the most electricity during an early season heat wave this year. We know many people in BC are struggling with extreme heat and that there are often limited options available to them when it comes to cooling. As our once milder springs and summers become warmer, air conditioning is no longer being considered a luxury among British Columbians. It is so vital that we get air conditioning to those who really need it, our most vulnerable populations, including seniors, those with disabilities, and lower income populations. And that's why this funding announcement is so important. The $10 million the province is providing will allow us to expand our Energy Conservation Assistance Program, helping to provide free air conditioning units to low-income and medically heat-vulnerable people. And that's about 8,000 units to be installed over the next 3 years. It's a major step forward and will build off other programs we have in place to help British Columbians access cooling devices. In addition to the new funding being announced today, we've also partnered with other organizations this year to provide additional funding, like the Aboriginal Housing Management Association and the Praxis Spinal Cord Institute and Technology for Living. Finally, until July 28th, BC Hydro is offering all customers, all residential customers, $50 off the purchase of a qualifying energy-efficient room air conditioner. We know after the last 2 summers, many British Columbians are looking to air conditioning to keep them cool, but cost is a barrier for many. We hear our customers, especially those living in apartments, condominiums, and mobile homes, that tend to struggle with heat the most and often have limited options when it comes to cooling. We're committed to continue working with government and other organizations to provide assistance to those that need it most. Thank you.
Thanks very much, Chris. Now for questions.
Reminder for reporters on the phone to please press *1 to enter the queue. That's *1 to ask a question. For media in the room, please line up at the microphone provided, and please make sure to provide your full name and outlet. Media will be limited to 1 question and 1 follow-up. We will be starting in the room today. Please go ahead.
Hi, Minister. It's Penny from CTV, just for the people on the line. Two-parter for my first question for you. How fast...
That's a global television rule, isn't
Well,
it?
you don't
The
think
two-parter thing?
really
I agree. I totally agree with that.
How fast are people going to be able to get access to these units? Like, is it possible for this year? And, you know, hydro bills are already really expensive for people on fixed income, low income. Is there any, it's great that you're helping with the unit, but in terms of the actual hydro bills at the end of the month, is there any assistance for that? So how fast, and will you be helping with the operating costs for these?
Well, this will take place starting this year and through the next 3 years. Not immediately, but there are other measures that BC Hydro takes to support people on bills. In addition to people's units, we'll see it probably in some multi-unit buildings where we create cooler areas, for example, in a lobby, if that's the appropriate place to be, where people would be able to go during heat events. Principally, this is to protect people through heat events. But other jurisdictions, you're quite right, such as California, have looked at those other issues, and those are things we may look at over time. This is a very significant program. Other jurisdictions, such as Oregon, have started this program. This is significantly bigger than that program, and I think we're going to be going this year, and we're going to be continuing after that. But it'll be starting this year, absolutely.
Second question is just around accessibility, just kind of in the broader sense, because I keep hearing from people, oftentimes they're elderly or they're people with disabilities, that they say, you know, I saved up for an air conditioner, I want to get it in my home, but my strata won't let me. And now there's this battle between individuals and stratas that have these ironclad rules. So what is the plan for that? Like, are you going to be able to empower doctors to write a prescription for an air conditioner, for example, to get around these strata rules? Or what are the plans for people who can afford it but are not allowed to install it?
Well, disproportionately, of course, people who are vulnerable tend to be in rental units. Although, as you quite rightly note, not exclusively, and in some strata, of course, people are renting as well. Know that. So it's our intention to work with both organizations of rental owners and organizations of strata providers to make sure we get around those circumstances where required. Equally, yes, that home health units are essentially, health authorities will be working with BC Hydros to make referrals in some cases. So there will be an opportunity to apply for an individual. There will also be an opportunity especially for our people, the health authority people in community, to make specific referrals. And, you know, this is a new area of activity, and there will be issues, and how we get around that is working closely with both organizations of rental providers and strata council organizations to break through some of these issues, and I would expect we'll be able to do that. In the early term, of course, there's the work that BC Housing is doing with BC Hydro, which is important. Not really an issue there, except for practical considerations in some cases. So we're looking at different options there. That's already underway. And in terms of rental units, and I'll tell you, just you see, if you go along Kingsway, which was one of the places from Fraser to the brow of the hill in the US, there's a lot of, for example, 4-story rental units where a lot of seniors live. And those units were particularly vulnerable during the period of the heat dome, and that's a real focus for us. But you're right, there will be issues as we work our way through those, and but I believe working with in good faith, we can work through those issues. Thank you.
Our next question, we're staying in the room. Please go ahead.
Hi, yes, Monica Gould with City News.
Hi, Monica.
Hi. The 8,000, how will it be chosen who's getting essentially a unit, and is 8,000 really enough over 5 years?
Well, first of all, it's over 3 years.
Oh, sorry. 3 years.
Second of all, when you include BC Housing, it's almost 10,000. And so there will be two ways of doing it. People can apply, and there will be a system to assess and then provide. And then, as well as noted in the response to Penny's question, that we'll have the ability of home health and our health authorities will work with BC Hydro to refer someone. So if we have someone who's receiving, for example, some form of home health, or is involved in an adult day program, a senior's adult day program, or has other involvement, they may not be a senior at all, but be in a vulnerable category, it will be possible to do both. For the health system to refer, and therefore target a good group of people, and in addition, for people to apply themselves if they're in those circumstances. So, and if you look at, I think Oregon's program was about 5,000 across their communities, but this will allow us to focus on a lot of communities where there's demand. In terms of the healthcare system, acute care hospitals are essentially have air conditioning systems in place, and the older hospitals now are being replaced, such as St. Paul's, but I was in Dawson Creek yesterday, and Terrace and so on, Mills Memorial and Terrace and so on. In long-term care, we've already taken significant action, so that's another group of vulnerable people. Our home health workers, which means people who work in the community, work with, particularly with seniors in the community, will be able to identify people, and then people will be able to self-identify. It's a pretty significant investment in air conditioners. It may be that demand exceeds it and we will have to do more, but this is an extremely strong statement and start in terms of focusing in on vulnerable people.
And next question has to do with just preparing for heat domes in general. You mentioned all the progress that the government has done. I guess I'm curious, I mean, there are some experts who would still say that if the heat dome happened again today, we would still not be prepared, we'd still see deaths. How is the province chipping away at the recommendations, and when will the province meet all the recommendations that came out of the coroner's report?
Well, and people have been expecting a report from us, and they'll be posted later today. I think there'll be a report on that progress. But you see the progress we've made, again, based on those recommendations, all 14 recommendations. But look, this is just a fact. Climate change is bad for human health. And we are going to have to deal and adapt and evolve and become more resilient, and we have to take action on climate change as a communities, as a province, as a country, and in our world. We have to take action on climate change because people are quite right. As extreme weather events change. I mean, I do feel, as, at least in my neighborhood, that it feels, I don't know California very well, I don't leave the province very much, but it feels a little bit like California sometimes in the periods of sense of drought in communities. In Vancouver, we're a rainforest community. This is not our experience, and we have to adapt to that. So yes, we have to become more resilient, but anybody who thinks you can simply adapt to climate change, we need to take action to reduce climate change in our world. And that's why government has such a powerful agenda in that area, because if we continue to see these kind of heat events, it does negatively affect human health, our communities, our society in innumerable ways, in terms of health, in terms of life expectancy, in terms of our economy, and our and of course ultimately it can profoundly affect our existences as communities and as a world.
Just a final check for any more questions in the room before we head to the phone lines. And we'll head over to the phones, and our first question there is from Richard Zussman. Please go ahead, Richard.
Prime Minister, how is the assessment being done to decide whether someone is vulnerable enough to have access to one of these air conditioners?
Well, what we'll do, through BC Hydro, and we'll be doing some of this work now, is there'll be a way to apply, and then an assessment will be done. Some of the assessments will be health assessments done by health authorities, as noted. So, like every other such program, there will be an assessment process, but it's pretty broad, and 8,000 air conditioners under this program, plus the additional ones that are already committed to by BC Hydro and its partners. That's a significant group of people.
Richard, did you have a follow-up?
There's a family doctor clinic, we understand, in Abbotsford that has 3 doctors who are retiring. It's likely putting more than 1,000 patients at risk in terms of attachment to their doctor. What suggestions are there, or recourse is there for patients in this situation that have doctors that are retiring in terms of getting reattached or accessing the primary health care system?
Well, more family doctors. And that's precisely what we're doing. As you'll know, we have, with our new attachment model, well over 65%, I think 65, 66% of existing longitudinal family practice doctors have joined the new payment model. In addition to that, 586 doctors who did not practice longitudinal family practice last year, in the last fiscal year, have joined the new model. So this is significant. As you know, that means that, and we're hearing quite stories now of greater attachment. We added, for example, 140 doctors in the new to practice under the new to practice contract who were, by definition, didn't have attached patients and now do. And we're building out, and those doctors are building out literally tens of thousands of attachments. I suspect if 3 family doctors are retiring, it's more than 1,000 patients in question, Richard. But what we're doing and what we're changing, and we'll have quite a bit more to say very, very soon on this question, we're building out an attachment model where people will be able to engage through HealthLink BC and request a family doctor, and as well, all those doctors who are joining the new payment model are providing their patient rosters. And this is going to create opportunities, certainly over the next number of years, for people to get access to family doctors. One of the most frustrating things for several groups of people without a family doctor who suddenly have health needs. They may not have chosen to have one before. People who have moved to British Columbia, people who lose their family doctors, have is this sense that they have to call around and maybe find someone, maybe not. Well, what we're putting in place through HealthLink is a rostering system based on a fundamental change to the way we provide primary care. 586 incremental doctors, that's pretty impressive, and it reflects the fundamental change to primary care that's taken place in our work with the doctors of BC. In addition to that, as you know, we've tripled the number of nurse practitioners practicing in BC in my time as Minister of Health, and are building out primary care networks. But I'll have a lot more to say about primary care in the next little while, Richard.
Our next question is from Mary Griffin, Check News. Please go ahead.
Keith, that's so true, isn't it?
Mary, are you there?
Oh, hi. I'm sorry about that. Minister, I just had a question is, so there's 10,000 units available over 3 years, and I'm just thinking just in the city of Victoria or some of the other communities that could be, reached in a very short amount of time. I'm just wondering, where was that number reached, and why is it in light of the need for such a low number?
I think, first of all, a significant number of people, of course, have air conditioning now, and air conditioning systems are not in vulnerable categories. Our view was that this would be an important place to start. It's a very significant investment. We did in our review, in our report on these issues, a report that we did with the Ministry of Social Development, and it was a recommendation of the coroner. We did a review of programs in other states and jurisdictions. As many people know, are in Eastern Canada, heat events in places such as Montreal and Toronto and American cities such as Chicago and New York have been relatively common occurrences over time. It had been, prior to the heat dome, some significant period in BC since the previous heat wave that had affected in a significant way people's lives. And so we assessed based on those programs, the take-up of those programs, the management of those programs. We looked at those programs that existed that support air conditioning. And we felt that this significant $10 million investment, in addition to the really remarkable work that BC Hydro had already initiated, was a good place to start. It may be that demand is higher, but we want to focus in on those people who receive home health, and of course all the work we're doing with BC Housing, where a significant vulnerable population exists, and in places such as long-term care and assisted living. All of that work is happening together, and some of that investment is well more than the $10 million that is being proposed here.
Mary, did you have a follow-up?
No, I'm good. Thanks very much.
Thank you.
Our next question is from Gordon Hoekstra, Vancouver Sun. Please go ahead.
Hi, Gord.
Thank you. Minister, I'm just wondering, why has it taken so long to make this decision? South of the border in Washington State and Oregon, almost before the next summer, they had already made decisions around these kind of things. And by the end of this year, I believe there's going to be about 23,000 AC units delivered to those that are most vulnerable. We're just starting. How come it's taken so long?
Well, I was here in Vancouver because there were a number of issues that came out of the heat dome within really days, maybe a couple of weeks of the heat dome, to announce significant increased in resources in emergency response in BC and BC Emergency Health Services. And you see the results of that. More paramedics, a long-standing agreement to improve the quality of work at BCHS, more dispatchers, more ambulances, and indeed more air ambulances, more helicopters. So that work started within weeks, and we saw results of that work within months. In addition, the work we were doing, which was related to this and the pandemic and long-term care, occurred and has been occurring over the last number of years. And as you know, over the last number of weeks, we've made some of the most significant healthcare announcements in recent memory in terms of building new long-term care. Over $1 billion in announcements that you'll be well aware of, Gord. And so all of this is taking place, and that's a transition from the past. So what we have here is a comprehensive response. In 2022, the new emergency response system, it was put into place. The HARS system was put into place in 2022 within a year. So we have been responding, I think, significantly to the report of the coroner, to the work of the BC Centre for Disease Control on these issues. We had reported out, I believe, in the fall of 2021 to the UBCM, Dr. Henry, Dr. Henderson, and myself, and we've been taking action since. So we've looked at these measures, we did a review of them, we did a review of other jurisdictions, and we're coming forward with the program today. And I think this is a good and necessary step.
Gordon, did you have a follow-up?
Yeah, I'm just wondering also about the timeline over 3 years. and whether there's any stipulation about why that length of time instead of trying to get the units out as quickly as possible, and whether there's a cap, to the first year or each year that you're expecting to do a third.
Well, I think we're going to proceed. I mean, BC Hydro is well suited to this because they have a number of income qualifying programs, so they're well set up for this. They're well set up to address these issues. So there's a maximum household income before tax that allows you to qualify. There's an application process. All this information will be available to you, Gord. So they're well suited for this, and we're looking to proceed right away. And that's the goal over the next 3 years. It's not to do it all in the first month, but we have a system in place. BC Hydro is well prepared to deal with that application process and that system. But we still have to purchase and acquire and install air conditioners, and that can take some time. So we're proceeding. We would hope to do a significant amount in the first year and then have them built out over 3 years.
Our next question is from Wolf Deppner, Black Press. Please go ahead.
Yes, thank you for taking my question. Earlier you mentioned that the report updating or sort of reviewing progress on the recommendation from the coroners is coming out later today, if I understood you correctly. What, if any, information can you share at this stage where the province stands when it comes to sort of updating the building code for both, both a passive and active way to help improve, protect against heat events? What, if any, information can you share on what building code improvements stand?
So the report primarily we were asked to look at the issue of air conditioners, and so the report primarily deals with that, but reviews and does a survey of other actions taken, including actions by my colleague, the Minister of Housing, Ravi Kahlon, and actions they're looking at with respect to the building code. So I encourage you to look at that. But really the focus of the report and the recommendation here was to proceed with just such a program that we're putting in place with BC Hydro, and there's more information on that in the press release, and we'll be providing more information as they post a program about the availability and access to that program based on income and all the other issues.
Wolf, did you have a follow-up?
Yes, I'm going to ask a two-parter here. Forgive me. When is the earliest we can see these air conditioning systems go out? And earlier you talked about the eligibility requirements. What, if any, income thresholds can you share at this stage? At what stage, at what income do you become eligible here?
So there's a whole series, and we can list them off. It'd probably be better if I just shared them to you, because it depends on the number of people in the household and the maximum household income. But we can share all that information with you.
For our next question, we're going to Lisa Yuzda, City News. Please go ahead.
Hi, Minister. I'm just wondering how humble you can be. Like, if you find that the response and the desire for these is far greater than what you've estimated, how quickly can you add more?
Well, I think, remember what's happening here. I mean, BC Hydro is already working on its partnership with BC Housing. We've already done a massive and continuing investment in long-term care that's going to continue. And of course, we have to do this well and appropriately and safely with trained people putting it in place. But I think this is by standards on the Pacific Coast anyway, an ambitious program that will help keep people safe. And so BC Hydro has, I think, very impressive capacity to respond in these issues, and they have here, and they've really stepped up as an organization, and I am really grateful to them. They have a lot of capacity to administer these very kinds of programs, because they do administer these kinds of programs, especially for low-income people, especially for vulnerable people now. So I'm confident they'll be able to do the work, but it's still, one air conditioner at a time, so it's going to take some time.
Lisa, did you have a follow-up?
Yep, there's a group called 619 BC, who's focused on changes following the deaths of the people 2 years ago. And one of the things they're asking for is for 24-hour cooling centers. Is that something that will be broadly available? And they're also looking at a maximum of 23 degrees interior temperatures as a longer-term goal. So are those possible? Are they necessary?
Well, what I can tell you, and you see this in the government's actions on the coroner's recommendations, on the recommendations we had, and the advice we received from the BC CDC, from the provincial health officer, we're taking a menu of action here to respond to this issue, and we're going to have to do more. And I want to emphasize, though, included in these actions is a comprehensive plan to address climate change in our province, led by my colleague, Minister George Heyman. Because it's not just becoming more resilient, that's important, developing resilient institutions, and you saw that in the significant investment working with community groups, with municipalities, with Indigenous organizations that we've already made. The HAR system has been put in place, and this action today. This is a comprehensive response. But the response is not over. I think you're right, Lisa, because we're living in this time of climate change. And it should be required of us to take action on climate change. And we are, and we need other jurisdictions to join us in that effort and work with us in that effort. And in addition to that, we need to continue to adapt and adapt again, and we will do that.
Our next question is from Lauren Collins, Black Press. Please go ahead.
Hi, my question is for BC Hydro CEO Chris O'Reilly. So you were talking about BC Hydro breaking peak records back in May. How do you see these additional 8,000 or 10,000 units impacting power? Is there a concern that it could max out?
Yeah, in British Columbia, the demand for electricity is much higher during the winter, during the heating period, and that is true by quite a large margin. So while we are seeing growing loads during summer periods as a result of air conditioning, we have lots of room to accommodate these new uses of power in the summer period. So we're all good for electricity for air conditioning, particularly for these units.
Lauren, did you have a follow-up?
Yes, also for Chris. Again, so BC Hydro is looking for new power options. Assuming this will have an impact, is BC Hydro taking this into account while you're looking for these new power sources?
Yes, well, we're in the midst of an energy transition in the world and certainly here in British Columbia. So given the demand for electrification to replace the use of fossil fuels, we're forecasting a significant growth in load in the province, demand for electricity, and that is why we've announced a call for renewable power to add to our system. Our forecasting for electricity includes the increased use of air conditioning in summer periods, which would also, a subset of that is this kind of program. So again, this is well within our capability and the plans we already have to acquire more electricity.
And we have time for one more question. Our final question today goes to Jennifer Mager, Radio-Canada. Please go ahead.
Hello, thank you. My question is in French for Minister Dix. So first one, the question has been asked in English. Comment les personnes vulnérables vont-elles être sélectionnées dans le cadre de cette initiative?
Excusez-moi, j'ai pas bien entendu votre question.
Comment les personnes vulnérables, donc les personnes qui vont bénéficier des climatiseurs, vont-elles être sélectionnées?
Oui, de deux façons. Premièrement, il y a déjà des critères pour BC Hydro pour ces programmes pour des gens qui n'ont pas de revenus, beaucoup de revenus, n'est-ce pas? Donc, il y a toujours une moyenne. Donc, c'est une autosélection. En ces cas, il faut faire une application à BC Hydro. Deuxièmement, les régies de santé vont choisir, surtout ceux qui travaillent dans les maisons, dans les appartements des gens, pour les soutenir, vont pouvoir travailler avec BC Hydro pour choisir des gens qui ont besoin de ces services, donc des climatiseurs. Donc, je pense qu'il y a deux faces. Autosélection, c'est-à-dire quand on fait une application soi-même. Autrement, il y a le rôle des régies de santé aussi. BC Hydro aussi a un partenariat avec BC Housing qui est en place maintenant pour soutenir et pour ajouter des climatiseurs dans les logements sociaux dans la province. Donc, il y a tous ces moyens-là. C'est un programme la province a fourni 10 millions de dollars à BC Hydro pour soutenir ce programme. BC Hydro a déjà fait des investissements aussi, donc c'est un programme important.
Jennifer, do you have a follow-up?
Yes, I do. Votre gouvernement compte-t-il apporter des modifications au Residential Tenancy Act pour y ajouter une température intérieure maximale?
Il faut bien entendu considérer des suggestions. On est en train de répondre aux recommandations du coroner et aussi les idées, les recommandations du BCCDC et d'autres pour prendre cette mesure aujourd'hui. On a fait un tas de mesures aussi pour rendre plus résilient notre réponse au changement du climat dans notre société. Et on va continuer à considérer cela. Et il y a des suggestions, bien entendu, d'autres organisations, mais aujourd'hui, c'est un investissement important pour protéger des gens, et c'était des gens vulnérables qui ont plus besoin de ces investissements dont on donne la priorité actuellement.
Thank you, everyone. That's all the time we have for today.
Thank you.